Thank you so much. Good afternoon, everyone. My name is Allyson Belton, and I'm the Director of Education and Training for the Satcher Health Leadership at Morehouse School of Medicine. We are here today with my colleague, Jareese Stroud, who will introduce herself shortly, to discuss with you accelerating the journey to health equity through leadership training. At this time, I'll now turn it over to my colleague, Jareese, to introduce herself. Jareese.
Good afternoon, everyone. I am Jareese Stroud, Associate Project Director here at the Satcher Health Leadership Institute. Happy to be with you guys today. Thank you.
So to get started, we just want to ensure that you all know that we have no financial or other relationships with any of our commercial entities that may be discussed in this educational activity. And we look forward to providing you an overview of the Satcher Health Leadership Institute's training initiatives and strategic direction. So just to give you a little bit of information about the Satcher Health Leadership Institute. The Satcher Health Leadership Institute was founded in 2006 under the direction of the 16th United States Surgeon General, Dr. David Satcher. Under his leadership and direction, we have taken on a number of health equity-based training, programmatic, and research initiatives in order to bring about changes in health disparities and health equity. Our vision is to be the leading transformative force for health equity, and our mission is to create systemic change at the intersection of policy and equity. We do so by focusing on three primary priority areas. Those areas are health systems transformation, mental and behavioral health, and the political determinants of health, the framework from which our training programs, current training programs, are developed. We do this by approaching health equity from the leadership capacity, research and evaluation space, community engagement, and intersecting at policy. Now, a brief history about our health equity leadership training within the Satcher Health Leadership Institute. Since 2009, SHLI has been training diverse groups of exceptional leaders in order to address and promote policies and practices towards achieving health equity and eliminating health disparities. Our programs and fellowships have engaged a number of diverse audiences, including elected and appointed legislative officials, community leaders and advocates, academic and healthcare professionals, public health students and professionals, and postdoctoral professionals. Since that 2009 period, we are proud to say that we have engaged over 600 individuals who have gone on to take leadership roles across the country in academia, healthcare, government, community-based organizations and agencies, as well as other public health and community health focused institutions. Our existing fellowships and program focus on leadership development, health policy, and health equity. So at this time, we actually have about 5 current programs that we are operating. We have several collaborative engagements with some of the organizations that you see on screen. And so at this time, we wish to highlight just some information about our programmatic efforts. The first of our programs is the American Medical Association Satcher Health Leadership Institute's Medical Justice and Advocacy Fellowship. This is a one-of-a-kind fellowship that was actually initiated in 2020 through the direction of Dr. Aletha Maybank and Professor Daniel Dawes. We are currently engaging our very first cohort of learners consisting of 12 physicians from across the country in a variety of specialties. The purpose of this particular program is to enhance physicians' advocacy leadership skills in order to improve health outcomes and advance health equity in the communities and among the patients that they serve. And so through this program, we engage in monthly learning sessions and provide a mentoring and training platform to help equip these physicians with some foundational knowledge and skills to be able to engage in institutional and political health advocacy. Many of these physicians come from a background where they have instituted some very minute advocacy changes or have, a ground floor knowledge of political advocacy in the healthcare space. And so we wanted to use this opportunity to target resident physicians and currently practicing physicians across all career stages who have an interest in health equity and health advocacy, and who know that they are well positioned to be able to institute some form of change in the areas in which they serve. Our next program is a partnership with the Association of State and Territorial Health Officials, also known as ASTO, for our Diverse Executives Leading in Public Health program. So the purpose of this program is to increase professional visibility and exposure of mid to senior level governmental public health officials who are from underrepresented identity groups and not necessarily seen in the executive spaces of health leadership, state and territorial, and other governmental leadership roles. We are taking these learners who are interested in pursuing an executive level career and providing them with support as needed to be able to engage in personal and institutional advocacy, while also developing their own professional identity and helping them to develop a career plan. We create opportunities through this program for them to network with other health officers and health organizations, those who are in leadership capacities across the local, state, territorial, and federal government entities. And we also provide a peer support network for these individuals to learn from each other. And so with this group, they have been able to engage in quite a few legislative activities, as well as meet with each other and take time to learn how to prepare legislation, how to prepare their own leadership journeys, and to just have an awakening of themselves as it relates to their personal leadership drive.
Thank you, Allyson. And our next leadership program is the Community Health Leadership Program. The objective of this program is to develop and enhance community health leaders who are educated, motivated, and mobilized to lead community groups in changing health behavior, improving environmental health, and influencing policies to support community health. And I want to say that this was our first time that we actually focused on the environmental justice and health sector, which was absolutely wonderful. This was our first national cohort. And so our community health leaders come from across various sectors. They are multidisciplinary. They come from all different types of backgrounds. Some of our participants included undergraduate and graduate students, community organizers, health system administrators, academic and faculty, and researchers. And it was a wonderful, wonderful program started on March the 4th. It is an 8-session program, and we ended with our graduation on April the 14th. Our graduation featured speaker was Dr. Waterhouse, who is the EPA director. And so it was a wonderful, wonderful, wonderful program.
And I'd like to add that this is among our current programs, our oldest program in operation. This program was first initiated in 2011 and was actually held in person. But as we have seen through this current climate, we've had to adjust and to make changes on the fly. So for the last 2 years, we have offered this program virtually. And as Jareese mentioned, we convened our first national cohort on last year. And we are proud to say that with this year, we convened our first international cohort featuring participants from the Philippines as well as Canada.
And our next project we are totally excited about is our PDOH Learning Laboratory, our Political Determinants of Health Learning Laboratory. And the objective of this initiative is to support diverse groups in building equitable and sustainable pathways for healthy communities by providing an opportunities for leaders and community champions to enhance skills in policy and health equity. These participants work on creating actionable steps toward alleviating disproportionate health outcomes by utilizing our political determinants of health framework. The elected and appointed officials and community members, they work together to better be equipped to develop and implement actionable solutions to close the health gap. The training fosters community partnerships between the participants, officials, and their partner and community-based organizations. And our target group for this specific initiative, we have partnered elected or appointed officials and our community-based organized members to work together. And these members, again, have come, this is a virtual program that we've had, one of our first virtual programs for our PDOH Learning Laboratory, and they have come again across from the state. This has opened up a wealth of opportunity for us to reach out a little bit more nationally. And then we have also our environmental health program, which was taking action, advancing conversations on climate change, environmental justice, and health equity webinar series. This was a lunch and learn series, and the training objectives for this was the series focused on addressing civic engagement, climate change policies, community mobilization, water quality, carbon emission, energy and power conversations, and climate change effects on vulnerable communities through a policy and health equity lens. This particular lunch and learn session took place over the course of a bi-monthly opportunity. So we had about 4 different series that took place with this, and we had our legislators, policymakers, institutional leaders, and community advocates to participate in this specific session. And we reached over, I would say, about over 500, 600 representatives or 600 community members, everyone from different backgrounds that actually participated or actually were able to watch the particular series. And with this particular series, we actually partnered with our Environmental Defense Fund, who provided funding for this webinar series.
Thank you, Jareese. So as you all will see from our presentation, we are on the move when it comes to training and educational opportunities for a number of different learners. This has been something that has been rooted among the priorities of the Satcher Health Leadership Institute throughout its 16-year history. We have partnered and work alongside very key strategic partners to actualize these programs and to make it a point to develop a network and create a space for individuals to come and learn, as well as discuss the needs in order to reach health equity. We do understand that in order for us to truly achieve health equity, we have to employ a collaborative approach. And so this is why we are proud to have engaged several of our key partners as we work towards a future of health equity. And so we would be remiss if we did not acknowledge these key partners, consisting of the Association of State and Territorial Health Officials, also the American Medical Association, the W.K. Kellogg Foundation, the Environmental Defense Fund, and the Marguerite Casey Foundation, all organizations who have partnered with us and have considered us worthy to spread the message and share a vision with us in training relative individuals. We acknowledge these organizations and we thank them for their support of the Satcher Health Leadership Institute and the support of our combined vision and mission. SHLI remains committed to sustaining, creating, enacting, and sustaining equitable and health policies. And we recognize that this cannot be done without educating and building the leadership skills and the leadership opportunities for all kinds of diverse leaders. In SHLI, we follow a slogan that Dr. Satcher has instilled in us, where everybody leads and everybody learns. And so we make it a point through our programs to engage learners from all different types of levels. In this way, there is an intersectional and multidisciplinary approach towards health equity. We know that this does not lie just in the hands of public health. It does not lie just in the hands of government. It does not lie just in the hands of community organizations. We recognize that it spans across these groups and across interest. And so that is why we are excited about where we're going with our programs. And as we take on these learning opportunities, also impressing upon these leaders what not only the social determinants of health, but the political determinants of health, to have an understanding of the systematic processes and the relationships and how resources, are distributed and how power structures operate in ways to either reinforce or influence one another. We understand that the leadership capacity of our participants falls with addressing these social, environmental, and political determinants of health.
Great. And so I have the esteemed pleasure of filtering through the chat and answering or helping to answer questions. And so one of our questions, Allyson, and you can take this one, is, can you explain a little bit more about what PDOH is in the framework and how we use it?
Okay, so as I mentioned, the political determinants of health basically involve the systematic process of structuring relationships, distributing resources, and administering power, all operating concurrently and simultaneously in ways that either reinforce or influence one another to shape opportunities that either advance health equity or they worsen the health inequities that we are facing. And so how we actually employ this framework within our training programs, we are training individuals to recognize what those structural, and institutional barriers are relative to the determinants that create the health inequities and health disparities that we see. And so the political determinants of health are rooted in government, voting, and policy. And so we take an opportunity to discuss each of these determinants, how their origins have from throughout history have created these determinants and created the social drivers that have basically brought us to the place where we are and will take us to where we hope to be in the future, and how they have just overall had an impact on the opportunities and resources that are in place for addressing healthcare disparities, et cetera. And so we want to equip our leaders that we are training to be able to take these determinants, again, along with the social determinants, environmental determinants as well, and allow them to discuss and go through trainings that help them to understand, not only understand these determinants, but be able to take these determinants and their understanding to develop and implement actionable solutions in order to close the health gap and make sure that we are addressing health inequities and moving our world towards a more equitable place.
Awesome. Thank you for that. And another question, and we do get this question a lot of times, Allyson, is you mentioned about the political determinants of health. Also, can you kind of explain or distinguish the difference between the political determinants of health and the social determinants of health?
So as I mentioned, the political determinants of health are rooted mainly in governmental places. So we look at government as a whole and how that structure is set up. We also look at the policies that are in place that contribute to various inequities and equitable places relative to to our health and our health outcomes, as well as how voting impacts where we are relative to our health outcomes. The social determinants of health are pretty much the conditions or the environment that basically impact the way we live, work, worship, play, and rest. And it too affects a wide range of our quality of life and how we function from a place of health. So there really is not that significant of a difference between the determinants of health, because we realize from an environmental place, these are all determinants that impact our environment, that impact these outcomes. But the political determinants of health takes a more nuanced look at three particular factors. Again, government, voting, and policy, and how it actually impacts our health outcomes. The social determinants of health take a look at the economics behind health and how our access to education and our access to quality education improves or worsens our health outcomes, as well as access to quality health care, how our neighborhoods and our environments, our immediate environments are constructed and built and set up to either help us in our health outcome, help us improve our health outcomes, or make this worse. And just also how community plays a role, how those social factors play a role in our quality of life.
Good, thank you. And another one of our questions, Allyson, and thank you for your comments. Another one of our questions is, our program serves so many different people with different backgrounds. We mentioned some of them may be multidisciplinary. How do we create a curriculum that serves, all of our different backgrounds, all of our different people that we have?
So that is a very great question, because as you can see, we do engage many different learners, and everyone is coming from a different degree of experience, a different place of learning, a different place of knowledge and understanding. So when we consider our curricula for our various programs, we again start with the foundation of the political determinants of health and the social determinants of health. That is our foundational base for the development of curricula. We then take an examination of, what type of learners we're engaging in our particular programs. So as you would note from our presentations, there are some very specific programs that are targeting very specific audiences. And so with that, we bring a somewhat of an assumption, a degree of assumption of where these particular or specific learners are and what it is that they would need to learn, or what type of knowledge that they would need to have in order to address health inequities and ultimately achieve health equity from their respective capacities. So for the fellowship, the Medical Justice and Advocacy Fellowship, we take a lot of content that is rooted in the healthcare space, the healthcare and medical space. We look at various policies from hospitals and from healthcare systems and correlate those with the legislative policies that impact maybe how healthcare receives its funding, or how physicians, to what degree they are able to act from a place of advocacy. And so we've tailored our content around that. Not only are we tailoring our content around that, we're tailoring the speakers and the faculty that we bring in for these particular programs. Very similar approach with our community-based programs. Those that engage those who are a part of community-based organizations, or work in non-governmental organizations, or just maybe a community leader who is interested in developing and strengthening their leadership skills and becoming a health advocate. that curriculum may have more of a community focus, how to effectively engage in community, examining, the points and the purposes of needs assessments, and how to form community academic partnerships or community agency partnerships towards achieving some type of goal or specific outcome. So we make it a point to tailor, we have a foundational basis for our curricula, but we make it a point to tailor that foundational curriculum, tailor it to the audiences to best address the needs and the context in which those leaders would be working.
Good. Thank you for that, Allyson. What has been some, is a question coming through, what has been some of your challenges with the programs that you lead? And even so, what are maybe some of the challenges going from in person to virtual?
Well, Jareese, I think both of us could respond to this question.
Yeah, we can. Mm-hmm.
And I would say, one, the challenge has been going from in-person to virtual. Mm-hmm. We've really just attacked this virtual space in the last 2 years. And I would say during this transitional time, we had a number of programs that were brand spanking new. They were in the conceptualization process right as we were transferring into the virtual space. So some of the challenges that we have experienced for a number of our programs is the ability to convene our learners. And let's just say, Zoom fatigue sets in for everyone. But, and we've had learners to miss out on opportunities to meet in person for scheduled activities that we've had scheduled, but a recent surge would have us cancel our activities literally a week prior to us doing so, or having to revamp our structure. Some of our programs meet on a weekly basis, some of them meet on a monthly basis, some of them meet bi-monthly. So having to change timelines and update, and just overall availability of individuals, recognize that our participants do have lives. They have full-time, many of them have full-time jobs in which they are working and operating. So trying to find the times that are convenient to engage these learners. Of course, we want 100% participation 100% of the time, but we do know that things come up and we are expected to basically work around these challenges. And I think we have been successful in doing so. But Jareese, if you want to share some of the challenges and opportunities.
Similar, but I will also say, you went through, I think you captured a lot about the challenges, but I want to say that by opening up the virtual aspect of this program, we've been able to go national, as you see, and internationally. And that's been totally, I think, awesome for our programs, because beforehand, of course, we would meet in person. And so most of our participants would come from Georgia or maybe the surrounding states. Someone would come and drive up, for our in-person sessions. But by being able to open this up virtually, we're able to reach a national cohort or another national group of people, and also international. And it's been our first time being able to do that. And so we get even a more diverse cohort. And as we all know, it's always good to have other people with other types of perspectives and thinking. And that's one of the things that we promote in our program, is to make sure that, we're all cooperating together, but also that we're all, I would say, taking in everyone's different perspectives that they can bring to the table. And so our cohort members love being able to work with people across, the world, because you can see just a different perspective of how people look at things, how people do things. And it also gives us an opportunity to really open up and show how we really pilot our programs, how we initiate or integrate the political determinants of health within every part that we do in our program, and also health equity, how we integrate health equity. And so it's been a very big learning experience. And that's been, I think, one of the best opportunities of being able to open it up nationally and internationally. And also it provides flexibility. It provides flexibilities for us as the teachers. And then it also, of course, provides flexibility as well for our program participants. And so those are some of the highlights as far as I'll say the opportunities that we've had with our programs.
And we've built into some of our programs some other in-person engagements.
Yeah.
We may have we're going to have our participants for 2 specific programs engage in meetings that are hosted and facilitated by our collaborating organization. So, that does provide an opportunity to still have that in-person engagement. And of course, we do look forward towards getting back to an in-person space with some of our programs. But we also appreciate, as Jareese said, the flexibility of this virtual world that we're in.
Yeah.
So
and
I would say that has been our biggest challenge, just navigating that.
And I also say, because someone asked about our engagement, how do we make sure that they're engaged while on Zoom? But we do build in breaks. And then some of our engagement, because we know that they're learning a lot and you're at the computer, so we understand you have to have breaks. So we have our meditation moments where we'll bring people in. Some of our facilitators, one of our big primary facilitators of our meditation, Dr. Kofi Kundani, and he goes through a meditation moment with all of our participants, being able to calm and come at peace and really integrate and open up and really learn and be ready to receive all of the knowledge that we have to learn by. So it just gives them a moment to kind of, as they've captured in or have been able to sit through and listen to a lot of the talks and the sessions, and then corresponding back with one another, but also having a session just to be able to meditate and kind of release and actually be able to digest some of the information that they've taken in. And then also we have our fun moments too, where we have our exercising opportunities, right? And so we'll have Dr. Jamie Hopkins come in because, sitting at the computer, you get kind of stiff, and so we'll have Dr. Jamie Hopkins come in for like maybe a 10-minute exercising opportunity to get up and move around, and something flexible for our participants to participate in our exercising moments. And they absolutely love that. We'll have on our music. We'll also have our participants maybe choose a song of their selection or what they like to hear. And so we'll play some of their songs. We kind of turn into DJs sometime. So we want to make sure that it's definitely engaging for them.
Yes, this is not something that we don't want any of our sessions to be sessions in which we're talking at our learners.
Yeah.
Our engagement goes beyond just having a speaker come in for a 1 to 6 hour period of time to work with our scholars and learners, but we also incorporate project work. We incorporate group work. We do use for some of our programs the Canvas learning management system. So that allows the learners to have additional engagement outside of our regular meeting time. We have our learners who have developed projects and they are working together on these projects. One such example is with our political determinants of health learning laboratory, where we have partnered elected and appointed officials with community-based organizations. And so at this time, they are actually actively implementing their projects, their health equity-based projects in the communities where they are partnering. And very similar with our Diverse Executives Leading in Public Health program, they actually have monthly intercession assignments that are either completed individually or completed as a group or completed in partners. So we do promote engagement well beyond the learning sessions, and we try to keep them engaged. We try to keep the engagement spirited, as Jareese mentioned. And, we really take an opportunity to embrace our learners, embrace their needs, and work with them in the way that they can be successful through the matriculation of our programs.
Yeah. One of our questions, Allyson, and I'm sure our participants would appreciate this, but it says, how do we measure the effectiveness of our programs?
So we have regular evaluation in all of our programs. We work with internal and external evaluators to evaluate our programs. We engage in surveying before and after each of our learning sessions for the majority of our programs. We incorporate pre and post test through our learning sessions with some of our programs. So that allows us to see that change in knowledge or that change over time, and we make it a point to line these evaluation metrics up with our objectives that we have developed for our program. So we are constantly evaluating, not just before the program starts and after the program starts, but actually in the middle of the programming. So we do engage in process evaluation as well as outcome evaluation.
Absolutely, absolutely. And then another one of our questions is from our feedback from our evaluation. And we all know that evaluation helps us to be able to improve, our programs. And we've received a lot of great feedback, but one of the questions is, what are some of the best highlights or best parts that our participants love about our program?
You want to take that part first, Jareese, or you want?
Yeah, sure.
Okay.
Sure. I'll say they love the virtual aspect about the program, but they also we kind of partner them. We always have some type of partnership where they get into groups. And so this gives them an opportunity to be able to learn from one another. And so we'll put them into the groups. And as Allyson mentioned before, we have them we make sure that they're understanding everything that they're learning and taking in. So a lot of our program feature at the end where they have to put together a project presentation. And so they love that aspect of the program because they get to work together and integrate everything that they've learned and showcase it at the end at a really big graduation. And then some of the feedback that we've learned from them from previous cohorts, I'll say, is they wanted more time together, right? And so we also built in time and we call them like fireside chats. So we built in kind of like fireside chats for them to kind of talk amongst each other. What did they learn from the program? How can we best work together to basically advance health equity? So they appreciated that we actually built in time for them, just set aside time for them to be able to get together and really digest everything that they've learned for today, giving them time to kind of talk about it. And so they love the engagement. And then we've also kind of have taken a lot of our leadership programs and we've kind of combined them at one time, so that they can all across each leadership program be able to meet one another too. And so that is some of the highlights that I have seen that they've totally enjoyed. And so another question is, Allyson, and this is a great way to kind of sum up everything that we've done and our conclusion, but we're doing a lot of great programs and they're all featured around health equity. How do we ensure, as political agendas may change and different leaderships may change, how do we ensure that health equity stays at the forefront of what we do?
Well, that is one of the reasons why we are mobilizing, and we're not just training, but we're mobilizing from our end a number of diverse leaders who can ensure that health equity remains a priority. And in the context of our current climate, our current environment, we're seeing more and more the various inequities and injustices that are impacting individuals, impacting not only our country, individuals, but our country and the world, our surrounding world. And so it's important that we continue to engage those from the individual perspective who have touch on communities, who have touch on systems, who have touch on organizations, who can go and spread the message that health equity is essential. And there is there will be no positive health outcomes as a whole without ensuring that there is health equity achieved in our future. And so that's where we stand. And we do believe that we will be able to advance health equity in our very small roles and the work that we're doing in our capacity by creating and mobilizing a group of leaders and those who are genuinely interested and truly committed towards achieving health equity, not only where they are, but for our society as a whole.
Well, I think that concludes our questions. Thank you, audience, so much. It's been a privilege and an honor being able to share what we do here at the Satcher Health Leadership Institute. I hope that you have all learned something from our presentation and even have been able to see where you can advance health equity as a leader. And so those are my remarks. Allyson, do you have any closing remarks?
And for additional information on our programs and activities, please visit us at www.satcherinstitute.org. So that is www.satcherinstitute.org for additional information. Thank you all for your time and attendance today. Have a great rest of your afternoon.
Thank you.